Եղբայրգուն փոլորիտ, ինչպես գիտեք, այսօր երկուշաբթի օր է եւ ամեն երկուշաբթի 7:7 California Eye Center, ես բժիշկ Harout Khanjian։ Այսօր ցեզի շատ հետաքրքիր հաղորդում ունիմ եւ հաղորդում են զած շատ քիծված կրնալա ոչ թե մինակ Ամերիկա, աշխարհային ամենակիծված oculoplastic surgeon իմ հետս է այսօր եւ շատերնի տեսնակ իրեն արդեն կճանչնակ ինքը eye aesthetic-ային ամենահայտնի բժիշկներից մեկն է իմ հետս այսօր Dr. Michael Burnstine. How are you doing, Dr. Burnstine?
Good. It's a pleasure to be here today. Thank you for having me.
Pleasure's mine. I know there are people watching the show right now saying that doctor did my eyelids and that's why I look 10 years younger. And if they get a chance to call, you will get some calls today saying thank you very much for the wonderful job you've done, not only for them, but on their behalf for our community. 25 years you've been operating in this community with a special emphasis on oculoplastics for eyelids, tearing eyes, punctas, all sorts of oculoplastic eye-related issues that have to do with the skin and the eyebrows. And if people have a chance to call, I'll say thank you on their behalf. Thank you for the wonderful work.
Pleasure.
Ուրեմն ցեզի այսօր բացատրեմ ով կա իմ հետս Dr. Michael Burnstine-ը։ Եթե գրնանք երթալ մեր website-ին, ինքը գրնանք միշտ գտնալ caleyecenter.com, եթե երթակ our doctor specialists դիտակ, կտեսնակ ինքը այստեղ Dr. Michael Burnstine, ինքը Harvard Medical School ավարտեց, Harvard Medical School-ի բժիշկ է, եթե իդ ստուդիո գրնանքալ, եւ հիմա ինքը այս վարյանին USC տասադու է, պրոֆեսոր է, oculoplastic, աշխատգերտներուն գսորվեցն է, ինչպես գոբեր կպարսրացնես, ինչպես գոբ կրնաս պարսրացնել եւ ճիշտ ցևով ընես, որ հիվանդը կրնա տեսողություն շահի եւ նույն ժամանակ քեղեցկության ցևով ինքը լավելա So քանի տարբեր տեսակ հաշիվներ կա եւ որ ադանք կորզողություն ունեք որ գրնա աթիվանտը իրեն ամենալավ result ստանա. So Dr. Burnstine, I was talking a little bit about you. 25 years in the community is quite a long time. Thousands of procedures. Harvard Medical School, currently teaching at USC, and you at this time work very closely in the Armenian community. And I know you have a presentation for us today, and you called it Armenian beauty. Tell me what that's about.
Current standards of beauty have really shifted, and what's become very popular is the ethnic Armenian, and I'm excited to share with you some of what's contemporary.
All right. And a little bit about, I always talk about this on my show. And we, especially when Dr. Simimi's on and Dr. Wong is on, we talk about how there are a lot of doctors out there that do upper eyelids, lower eyelids. They also do cataract surgery. They also do LASIK surgery. They also do all sorts of stuff. But there is a difference when you're going to a doctor that's specifically morning, evening, day and night, all they do is eyelids. And I talk about that a lot in our community, only because in Europe and even in Armenia, Russia, one doctor does everything. Does your eyelids, does your cataract, does your LASIK, does your glasses. But in America, we're very fortunate that we have these subspecialties where you spend years not only learning about the eye, but just specifically on the eyelids. So when it comes to patients asking me, doctor, where should I go? My first thing is always oculoplastic surgeon, a doctor who only specializes in raising the eyelids, treating the lower, upper blepharoplasty, lower blepharoplasty, and so forth. What has been your experience with that?
Well, interestingly, I'm seeing a lot of patients that go to Armenia for surgery and they have complications and come back here to be repaired. And so I think going to an eyelid expert is critical. And we're the doctors that train doctors to do what we do.
Right. Thank you, Michael. Let's go ahead and take a look at what we've prepared here today. It's called, again, Armenian Beauty. So, եթե գրնանք նե վիդեոին երթալ, let's see what you've got here for us.
Great. So what I'm going to be talking about specifically today are droopy eyelids, and specifically as it relates to the Armenian community. I think it's important to talk about key concepts of beauty, how we evaluate the face, and how we look at the eyelid-eyebrow complex in doing eyelid surgery. It's hard to define beauty, but we know what it is when we see it. In these two photos, they're the same person, but after significant plastic surgery. In the photos on the left, this young girl had cheek and jaw surgery to normalize her appearance, and you probably recognize the woman on the right as Khanjian, who is a newscaster who underwent a significant transformation by having double eyelid surgery and jaw surgery to transform her appearance to what we consider a more beautiful aesthetic or cosmetic appearance. I think it's important to know that there are differences between men and women in beauty, and beauty is unique to the individual. And on the two images on your right, you're seeing two Kardashian sisters, which are both beautiful, but beautiful in different ways. And the evolution of the Kardashians have really transformed how we think of beauty today. Specifically, when you think of beauty, what do people have in common? Beautiful faces have proportions, they have symmetry, and there's facial harmony. And you can see Kim Kardashian as an example of a symmetric face with symmetric eyebrows, which only occurs in about 5% of the population. Specifically with Armenian beauty, which has really become a contemporary or modern view of what people find beautiful across the world, are big, beautiful eyes, full eyelashes and eyebrows, curly hair, and curvy bodies. The one thing in Armenia and here today, which many Armenians feel is still problematic, is the nose, and I won't go into that at all today. But when you look through history at Armenian beauty, the first Turkish Miss Turkey was an Armenian beauty by the name of Araksi. You have Kim Kardashian, you have a Gucci model, and you have a very popular belly dancer who defined beauty in different ways. And each person comes to it with their own ideal of what is beautiful. When we think of the face, we think of the upper face, the upper and lower eyelids, and the mid-face. When we think of the eyes and upper eyelids, we think of the upper eyelid position, the amount of extra skin, the skin quality and texture, and the volume that's in the orbit. And this is an example of two patients that have droopy eyelids, and that's called ptosis. And it's visually significant. You can see the before picture above and the after picture below. Both have only had their eyelids lifted. On the image on the right, you can see that the eyelids are higher and the skin is more full, and that's frequently a consequence of lifting the eyelid up. These are examples of patients that have excess skin causing a droopy eyelid. By removing skin, their eyelid height and contour is improved, and they have a more youthful cosmetic appearance. That's called dermatochalasis, and removal of skin is called blepharoplasty. Oftentimes, the two go together, and we combine the surgery, where we do an eyelid elevation and skin removal to give the ideal youthful appearance. When we talk about eyebrows, again, it's the Armenian eyebrow that is now the definition of how we define beauty. In women, there's a slight arch laterally, and in men, it's flat. The eyebrows are full, and they are a little bit lower nasally towards the nose. As we age, the eyebrows fall, and you can see the aged eyebrow above where the temporal eyebrow has fallen compared to the youthful eyebrow below. Oftentimes when I see patients, I get asked many questions. Will my insurance cover the procedures? And it will if the droop is visually significant. If the excess skin that's present is not visually significant, typically it's considered a cosmetic procedure. Will my insurance cover the eyebrow droop? Typically they will if it's visually significant. And how long would it take to heal? Usually about 3 to 6 weeks. And finally, where is the surgery done? The surgery can be done either in the office or at a surgery center. So now I'm just going to quickly roll through some pre and post-ops, and then we can discuss with questions that you have with Dr. Khanjian any concerns or burning questions you have. So these are examples of patients that have had their eyebrows lifted and skin removed. On the left is a woman, on the right is a man, giving more youthful appearance. These patients have had their eyebrows lifted, their eyelids lifted, and skin removed to give a more youthful, symmetric look. Again, we strive for symmetry and a youthful appearance when we do surgery. This patient had her upper eyelids lifted and skin removed to give her a youthful aesthetic with no brow surgery. This patient had a droopy eyelid and lower eyelid retraction. We lifted her right eyebrow up and elevated her lower eyelids to give her an almond-shaped eye with symmetric creases and folds and a youthful symmetric appearance. No brow surgery was done. This patient had upper and lower eyelid surgery, skin and fat removal with eyelid elevation. Again, a more bright, alert, and oriented appearance. And finally, these patients had brow surgery, upper eyelid elevation, and skin removal. On the woman on the left, and I'm sure Dr. Khanjian sees a lot of this, she has xanthelasma, which are yellowish pigment in the upper and lower eyelids. We removed those at the same time we did her lower blepharoplasty. So I'm happy to answer any questions.
Studio Gërnankal. Thank you very much. That was a wonderful presentation. I'm very curious. You know, when you see these Armenian patients, we have a very distinct appearance when it comes to our eyes. And this is thousands of years of Armenians marrying Armenians. Our culture has always stuck together, and we've always been taught to intermarry with one another. So we've kind of kept this very unique, distinct feature when it comes to the shape of our eyes, even if it's our nose or our eyelashes and our eyebrows. When you go in to operate on somebody Armenian whose eyelids are drooping, how do you know exactly what the end product is going to be? Do you ever ask them, bring in some photos, let me see what you look like when you were younger? Do you have a sister, a mother? What are some of the ways that you can still keep that Armenian look for those patients?
Great question. So we, ask for old photographs if patients have it, and typically mothers will come in with daughters, and looking at the daughter will often inform us how a patient looks when they were younger, and we use that as a guidepost to define a unique, tailored surgical plan.
Thank you, Dr. Burnstine. And back to the insurance, I know they'll ask us, insurance does cover it. Let's say if it's a Blue Cross, Blue Shield, Aetna, Cigna, anything PPO will cover it as long as it's visually significant, correct? But there are some things that it will not cover. For example, the lowers, it will not cover. It's not visually significant.
Right.
So do you ever have situations where the insurance will pay one portion of the procedure and then the other parts of the procedure that are not covered? What would the patients typically do in those situations?
Right, so typically you'll come in for an evaluation. We take photos and do visual fields, and based on that information, we can clearly define what's covered by insurance and what's not covered by insurance. You're absolutely right, Dr. Khanjian, that the lower eyelids are never covered by insurance when you get rid of the bags and extra skin. What is covered is when the droop or eyelid position is significant enough that it's impeding vision, it will be covered. Oftentimes, the skin above will not be covered, even though the droop is. And so our team separates out what's covered and not covered and gives you a detailed roadmap about what's recommended.
Thank you. I'll explain that in a little bit here in Armenian. So for some of those that don't understand, I can kind of translate that. Ուրեմն insurance-ը, օրինակ Medicare-ը cover գնե այս կորվս կվճարե։ Բայց հիշեցեք, որ երկու խնդիր կա, երբ որ գոպը իշնա։ Գրնա այս վերի միսը ձալվի եւ իշնա, բայց գրնա գոպը բարձր մնա։ Եթե գոպը բարձր մնացեր է, բայց միսը մինակ իջեր է, cover չներ insurance-ը։ Բայց եթե գոպը իջեր է եւ դեսադաշտը կոծված է, դեսուղությունը խանգարված է, որով գոպը իջեր է, այնի cover կնե պետությունը։ So նորեն հիշեցեք, գրնալալ թարթիշին դեղը, եթե բարձր է, բայց վրայի հոնքի միսի իջեր է, Medicare-ը cover չներ ապի։ Բայց եթե թարթիշի մազը, այդ վերևի կոպը իջեր է ցած, այնին պետությունը cover կնե։ Հիմա շատ դժվար է ցեզի համար գիտնալ, եթե կա կամ չկա, նորեն քննության ժամանակ կրնանք մենք ցեզի ասել եւ թուգա գրնանք գիտնալ ինչպես գրնանք ադինել։ Բայց մեծամասնությունը որ գուքան տարիքոտները որ այս խնդիրը ունին, պետությունը կվճարե եւ եթե գուզեն իրենք ներքևիններ անեն, վճարում մգա ավելորդ որ թուք կրնակ տալ, բժիշկը գրնա վերը եւ ներքևինը նե նույն ժամանակ։ Back to a point you made about patients going to other countries, and this conversation was Armenia. I've seen that myself, and a lot of times it has to do with the experience and the number of cases they've done over the year. But I see them come back and they look like this. The eyelid is not able to close, and they sleep at night and there is a portion of the eye that's exposed. And now they have all sorts of issues with dry eye. We have to give them all these drops, these ointments, these lubricants, all because the surgeon that did their eyelids pulled too much. And because they now pulled too much, the eye is no longer protected and is exposed, and now secondary issues have now arisen. So when you're doing the eyelid, I know there's so much calculation you put into it, but in a very short way for us to understand, what are some of the things you take into account when you're trying to decide how much do I take out, how much do I leave, what kind of a look are we going for? Any little bit of that info you can share with us?
So one of the most common errors in doing eyelid surgery is removing the muscle responsible for eyelid closure. And when you do that, people can't close their eyes, or you take too much skin out, people can't close their eyes. So we measure meticulously to give the ideal crease and fold so that function is maintained while you get the best aesthetic result possible. And that's what really makes us unique.
Thank you, Dr. Burnstine. So նորեն իմ հետս այսօր Dr. Michael Burnstine, եթե գրնանքն է վիդեոին երթալ, սի մեր website caleyecenter.com, եթե երթակ այստեղ specialist-ի տակ, կդեսնակ Dr. Batin, Dr. Schultz, Dr. Burnstine, գիտեք արդեն Dr. Սմիմին, այստերեկա խումբի մեջ, Dr. Burnstine-ը Harvard-ի բժիշկ է եւ ինքը հիմա USC համալսարանում գոբերու պրոֆեսոր է, աշակերտներուն գսորվեցին է, ինչպես հաջող կորզողություն գլա գոբերի հետ։ Եթե իդ ստուդիո գրնանք կալ, արդեն մեր տելեֆոնի թիվերը գիտեք, live համարը իմ կովս է, գուզեմ ցեզ մելսել, ինչ որ հարցում ունի, գրնակ հիմա հարցնել։ Let's see what they got to say. Hello, ինչպես կրնանք օգնել։
Hi, Harout, ինչպես ես։
Hello, բարև ցեզ, այո, մենք live ենք։
Այո, ուրախ եմ։ Համացանցում ես TV ձայնը, որ Harout-ին լսենք։
Thank you.
Harout,
Այո։
ես նոր very professional you are, Azishan.
Thank you.
Եթե problem ունենա, դաշարբար կողոստի քամիերը։
Շնորհակալություն։
Դաշտեսակիստը նայում դենտիստ աշխերս դավաց կամար միսկոմ գետա։
Okay.
Տոնի ալքան։ Ինչ էր որ ասան սիմպաթիկ դարձեր է, միացել է, եւ այլն։
Oh, ինչու՞ չէ։ Thank you telefonit, ուրախ եմ Սարգիս տելեֆոների։ Այո, ես գրնամ ասել մոտավորապես 80 pound-ի հարցա, բայց ցուկ ամեն երկու շաբթի օրը ինձ դիտերեք այս 3 տարվա մեջ եւ տեսակ կամած ինչպես 3 տարի դեվեց որ ես կրծա այստեղ հասնել եւ բոլոր քախնիկը գերադիս վրան է եւ օրը դրա մասին կխոսիմ 20 pound-ա մնաց որ քիչ մնալ իշնամ որ գրնամ ասել 100 pound իջա բայց այդ ժամանակ ցեզի պիցեմ թուգա գրնա գնել եւ ով որ իմ հիվանդս է եկերեք մեր մոտ ինձի հարցուցերեք արդեն ցեզի ասերեմ առանց մարզան քնելով քախնիկը քիչ պիտուդես ճիշտ գերած բաները գրնամ ասել ցեզի հարգավ բայց օրը դրա մասին գրնանք խոսիլ տելեֆոններ կան ադոնք հասնինք ուրիշ անգամ մի մասին գրնանք խոսիլ բայց շնորհակալ եմ որ տելեֆոներիր thank you եւ օրը խոսինք ադոր մասին thank you տելեֆոնին hello ինչպես կրնանք օգնել
Բարև ձեզ մի հարց ունեմ
այո սիրով հարցուցեք
Աչքերի քորը
աչքերի քոր ունիք
Քորա գալիս
այո all right Okay ցեր քորը մաշկին վրան է կամ աչքին մեջն է քորը
Աչքի մեջն է
Եղավ շնորհակալ եմ տելեֆոնից So we got a call you can answer if you'd like she has itching And I asked her, is it more on the skin, the itching, or is it more inside? And she said it's on the inside. It's hard to tell when they're on the phone and they're not in an exam chair, but just as what you would possibly think as an answer for summertime, elderly patient, probably 65 to 7-year-old female with eye itching, what would be your thoughts?
Usually the number one thought would be allergies and chronic irritation from the allergens or pollens that are in the air, and those can be treated with drops like a steroid Predforte or a non-steroidal mast cell stabilizer like Cromolyn.
Yeah. So again, she'd have to come in. We can check and give her what's appropriate.
Right.
All right. Շնորհակալ եմ տելեֆոնիդ. Hello, ինչպես կրնանք օգնել?
Ալո
Այո, բարև, ինչպես եք?
Ես կուզեի իմանալ դուք կոպերի գործողություն անում եք թե չէ
Այո, մենք հիմա 20 րոպե դրա մասին խոսեցանք։ Իմ կովս դոկտոր Burnstine-ն է, գոբի գործողություն ինքն է անողը։ Դոկտոր Սիմիմնա գա, դոկտոր Wang-ն գա, ասոն գոբի մասնագետներ են, բայց եթե հարցում ունիք, կրնակ հիմա հարցնել, ինքը կովս նստած է։
Ես հիմա աչքիս կոպը ինչած է, բայց չեմ դիտել, աչքս կիսա բաց է հիմա, մեկ աչքս։
Okay, քանի տարեկան եք?
65 տարեկան։
Okay, եղավ։ Ասի մեկ անգամից եղավ կամ կամած։
Չէ, ես աչքիս մեջը կսրսկեին, որ շաքարախսոնս հիվանդ եմ ես։
Okay, եղավ, տելևիզիոնով կբացատրեմ, 65 female, she was receiving injections in her eye for diabetic retinopathy. And after those injections, she noticed her one eye now is hanging low. Is that something you can treat?
Usually it's ptosis from a speculum being held between the two eyes, and that is definitely something we can treat, and you need an evaluation for that.
Այո։ So ուրեմն կորզողության ժամանակ երբ որ կատարակ վիրահատեն, հատուկ կորձիկ մկա անունը speculum, կտնեն որ աչքը բաց մնա։ Կատարակտի ժամանակ կնեն եւ երբ որ սրսկեն, որոշ սրսկող բժիշկները այդ նույն գործիքը կկորզածեն, որ աչքը բաց պահեն, որ կրնան սրսկել։ Այդ գործիքի պատճառով կրնալ վերի մկանը թուլանա եւ սահի եւ այդ սահած ժամանակ մեկ աչքը ցածլա, մեկը բարձր, փամնե որ կրնանք բուժել։ Արդեն մեր ժամանակը մոտեցավ, we've got about 20 seconds left to go. I want to say thank you for coming on the show. Hopefully we can have you again. I know you're so busy doing lectures and talks. Thank you for your time. Our viewers definitely appreciate it. And anybody who has lid issues, they're coming your way.
Thank you. Thanks for your attention.
Շնորհակալ եմ բոլորիդ, գիշեր բարի։